So hi everyone and welcome. It's lovely and slightly daunting to see so many people here today. A big thank you to the Scottish Alcohol Research Network and Scottish Health Action on Alcohol Problems for inviting me, of course, to be part of the Alcohol Occasional series. Thank you so much to Carol for chairing, and thank you so much to Chris as well for all the help with the publicity that's contributed to the great turnout today. So today I'll be exploring and discussing issues around alcohol consumption, social inequalities, drinking transitions and home drinking during the COVID-19 pandemic in the UK. So what I want to do is draw on the findings of a quite small scale exploratory research project that I conducted in collaboration with Dom Conroy at the University of East London. Unfortunately, Dom can't be here with us today. So this study, we set out to explore the experiences of UK drinkers during the pandemic. And I have to give you a little caveat here. We didn't specifically set out to, explore issues of social inequality as the main aim of our work. But I'm hoping that as I start to talk to you about some of our analysis today, we'll start to see some interesting themes coming through around, how people's relationships with alcohol might be changing during the pandemic and whose relationships are changing, who might be better able to reconfigure their relationship with alcohol in the pandemic. And for others, might there be more, challenges or difficulties during lockdown that might make their relationships with alcohol more complex. So I'll be presenting some emerging findings, and I'll probably be raising more questions than answers, as this is all quite new, quite an emerging area of research. But hopefully what I present today will lead us nicely into a further discussion. And as this project is still a little bit of a work in progress and we're working on the analysis, I really welcome your reflections, comments and thoughts on taking the work forward as well. But just to give you a little indication of the structure. Now, I am going to spend a little bit of time today actually going over some background literature, because I think there's a number of different themes and bodies of literature that feed into what I want to talk about today. So I'm going to start by outlining a bit of the literature on drinking class and social inequalities, touching on the alcohol harm paradox, and then I'm going to think more specifically about this emerging body of literature on drinking in the pandemic. Now, obviously, this is a new area of research, and actually there's not necessarily a consensus out there about if, how and why people's relationships with alcohol are changing during the pandemic. So one of the things that we might want to do is think about the different ways in which relationships with alcohol have been theorized and thought about during this period. Then I'm also going to think a little bit about the literature on home drinking as well, which I think is quite relevant. I'll then talk a bit about the project itself, and then I'm going to move on to these three key themes that I want to talk about today that might open up some discussions. So the first is around this idea of lockdown as an opportunity for growth and self-development. And I want to ask the question, is this idea that lockdown is this teachable moment, this moment for growth and reflection, is this kind of interpretation of lockdown more easily available to some than others? And then the idea of precarity, stress and uncertainty during lockdown, how these might function as possible triggers for drinking. And again, might we link this in with notions around class and social inequality? And then finally, I want to think a little bit about notions of class and taste and the ways in which some of our participants talked about their drinking as kind of tasteful and classy and moderate in order to position their own drinking as, responsible, in contrast to more problematic ideas around drinking. So I'll talk a little bit about the limitations of our work as well, and then I'll finish with these questions or these, ideas, as I said, that might lead us into some further discussion. But I just really want to strip it back to basics at the start, and I want to ask the question, how can we think about drinking through a lens of social class, social inequality and socioeconomic status? So globally, the suggestion seems to be that actually people with a higher socioeconomic status drink more. For example, if we just look at the couple of examples I've put here on the slides, we start to get a little bit of a sense around how in potentially quite diverse global locations, things like a college education or higher socioeconomic status actually are indicators of an increased likelihood of higher risk drinking. So other research, we should acknowledge, does present a bit of a more mixed picture around this. For example, associating hazardous drinking or increased risk of alcohol-related disorders with lower socioeconomic status. However, if we turn more specifically to think about the UK, which is obviously the part of the world that I'd like to talk about today, If we look to the work of Waiter and Borgonovi, we can see that they suggest that actually better educated individuals are somewhat more likely to engage in certain forms of risky behaviours, and amongst this they include alcohol consumption. So according to the Health Survey for England in 2014, around a quarter of those in highest income households drank above the recommended weekly allowance, compared to only 14% of those in lowest income households. In contrast, we know that low-income households are more likely to abstain from alcohol and more likely to drink under the recommended weekly guidance. So if we again turn to the Health Survey for England for 2014, we see that around 28% of those in the lowest income households who took part in the survey said that they hadn't drunk in the past year, compared to only 8% of those in the highest income households. However, it's one thing to say that we think that those with a higher socioeconomic status drink more, but the picture starts to become more messy and complex when we start to ask the question of who is actually most adversely affected by alcohol-related consequences and harms. So I'm sure I'm preaching to the converted with many of you here, and many of you will be familiar with the idea of the alcohol harm paradox. So the idea, as Alcohol Change argue, that alcohol-related health harms are more pronounced in areas of high deprivation, despite the fact that average consumption is usually actually lower in those areas. Similarly, Collins provides the definition that people with higher socioeconomic status may consume similar or greater amounts of alcohol compared to people with lower socioeconomic status, but the latter group bear a disproportionate burden of alcohol-related consequences. So the argument here is the majority of increasing alcohol-related mortality originates within lower income groups, whilst Brearley-Jones et al. Argue that those with higher socioeconomic status have what they call a form of resistance to some of the negative effects of alcohol. So why might this be? If we zoom out a little bit and start thinking about other factors, we might bring into the mix some of these factors in this blue box here. So the ways in which alcohol harms may intersect with poor diet, for example, or other lifestyle factors such as smoking, with a lack of support services or lack of access to support, with poor living conditions, with stress and poor psychological health. So why am I talking a little bit about the alcohol harm paradox here? Well, I think, what we need to start thinking about as researchers is, could some of these factors in the blue box become even more salient during the pandemic? As the Scottish Government suggests, the pandemic is already widening existing health and social inequalities. And we could argue that we need further research specifically looking at alcohol in order to understand the ways in which drinking is entangled up with this as well. For example, we know that those that have been hit most hard by the economic impacts of COVID-19 are those who are already economically vulnerable. So we know that 30% of the lowest fifth of employees in the UK have been furloughed or lost jobs, compared to only 8% of the highest earning fifth. And other research, which I won't go into today, also suggests links between, for example, recession, unemployment, and higher alcohol consumption. And of course, and this is something I'm going to touch on when I turn to my findings, we know that stress may be exacerbated during the pandemic, as well as feeling more acutely the effects of living in poor quality or crowded accommodation, for example. So basically, what I want to argue here is that the impact of the pandemic on drinking and on social inequalities and the intersections between the two needs to be considered in more depth. So further research can help develop our understanding of the nuances of any changes to people's consumption practices during lockdown, and the ways in which drinking practices may link with or indeed exacerbate existing health and social inequalities. So turning now more specifically to COVID-19 and some of the research that's coming out here. So as I alluded to in the previous slide, I think the pandemic presents us with some real opportunities for new research around drinking practices, drinking spaces particularly, and health and social inequalities more widely. So we know that research that's coming out is starting to explore issues around possible increases in lone home drinking, for example, and also issues such as risk of relapse for those who are in recovery. So we know, for example, that there might be concerns around access to traditional support services that may not be so readily available and may certainly not be physically accessible during the pandemic. Turning to the wider drinking population then, we're getting a bit, and I'm going to say this a few times in relation to a few things, but a bit of a mixed picture in terms of how the pandemic is shaping and changing perhaps drinking practices. So we know that some evidence points to an increase in the use of alcohol support websites during lockdown. We know that the sales of alcohol have increased, although of course with the caveat that people are drinking more outside of licensed premises but not able to drink in pubs. And we're seeing some evidence of more frequent binge drinking. However, other research suggests that actually harmful drinking levels may be decreasing overall, particularly amongst younger adults. So again, as with the wider links that we were talking about in terms of drinking and class, the picture is complicated again, and it's difficult to see, how drinking practices are changing during the pandemic, and of course, whether and how this is linked into socioeconomic status, for example. But the research does appear to be presenting some slightly contradictory findings. I think, certainly the mainstream media would love to have a simple headline figure they could use to say, drinking soars during lockdown. But, the picture is much more nuanced. And of course, all of this research that's starting to come out now is new and is only really starting to explore this issue. Another important thing to flag up, and again, I will return to this actually when we talk a little bit about our findings, is these changes during the pandemic do not necessarily predict longer term changes in people's consumption, or necessarily even capture something more than just a snapshot in time. So we know that the pandemic's been rumbling on for far longer than any of us would have wished for. And even the things that I'm talking about today in relation to our research may show a different picture to what drinking looked like in, the third national lockdown in England in January 2021, for example. So these studies as well might, of course, be limited by the fact that, self-reporting of participants, which do not always reflect an accurate picture of consumption. I also just wanted to sort of entertain the idea, if you like, that we might want to think about, continuities and consistencies in people's drinking during lockdown as well. So an interesting piece of research here looking particularly at Scotland and England makes the argument that certainly within Scotland, there was actually no significant change in alcohol consumption levels or the frequency of drinking between March and June 2020 compared to the same period in 2019. And in England, overall levels of alcohol consumption actually fell despite increases in off-trade consumption. And as I talked about, obviously with the closure of bars and clubs, if we're seeing an increased trend of purchasing alcohol and drinking at home, we have to offset that against the fact that licensed premises aren't open. So what the findings here suggest is that heavy consumption has stayed the same in Scotland, and that we've seen falls in consumption in England. So no significant changes around drinking levels according to this research. And then the final sort of possibility that I wanted to entertain in terms of lockdown drinking is this suggestion that's coming through in the literature that what we are actually seeing here is more of a polarization in people's drinking patterns. So one question that we might want to ask here is, are those who were drinking more heavily prior to lockdown now consuming more alcohol, and are lighter drinkers more likely to have reduced their consumption or stopped completely? And if we turn to this survey from Alcohol Change in 2020 of over 1,500 UK drinkers, we can start to look a little bit into this idea. So they argue that according to their survey, more than 1 in 3 had either stopped drinking or reduced how often they drink, and 6% of those who completed the survey had stopped drinking entirely. In contrast, 21% reported they were drinking more frequently, and 15% said they were drinking more per session. But this little bit here is where it starts to get a bit more interesting. So the findings suggest that nearly 20% of those who were daily drinkers before lockdown had increased their consumption during the pandemic, whereas nearly half of those who drank once a week or less had cut down or stopped. This figure drops to 17% of when we think about daily drinkers cutting down or stopping. So the suggestion here is around something of a polarization in people's consumption, with heavier drinkers perhaps inclined to drink more and lighter drinkers more likely to reduce their consumption. And this is echoed in research by Oldham as well. So Oldham et al. Also argue that increases in consumption are more likely to be reported amongst those who are already heavier drinkers before the pandemic. Similarly, the Institute for Alcohol Studies again reports similar findings around a rise in the proportion of both non-drinkers and high-risk drinkers, and interestingly, similar proportions of people drinking more than before and less than before. And again, this point here is interesting, this indication that actually the most frequent drinkers have increased their consumption the most. So sort of mirroring what we've just talked about with the alcohol change survey. So this again has some interesting implications in terms of further exacerbating existing health inequalities if those who were already drinking at higher levels before the pandemic are seeing the biggest increases in their consumption. However, once again, another mixed picture if we start to dig a little deeper and ask the question, okay, well, who do we think is drinking more during the pandemic? So Garnett et al. Actually argue that we're seeing the biggest increases in consumption amongst those with post-16 education and a household income above £30,000. And Alcohol Change also argued that those with higher socioeconomic status were more likely to say they were drinking more. Contrast that, if you will, with these findings from Oldham et al. So they've suggested that actually an increased frequency of drinking during the pandemic may be associated with some of the following factors. So deterioration in psychological well-being, and deterioration in physical health and living conditions and finances, and being furloughed. So again, we need to ask the question, who is most likely to be affected by some of those kinds of changes during the pandemic? Does that suggest a slightly different picture in terms of who might be more likely to be seeing increases in their consumption? So the final body of literature that I wanted to talk about before I get on to thinking more specifically about the project itself and about the findings emerging out of that is around the drinking on home literature. Now, immediately we need to flag the point that home drinking is nothing new and that we are not seeing, huge significant shifts to domestic consumption in the pandemic. Those shifts were already happening. So as Holloway et al. Argue, home drinking is already a very normalized part of many drinkers' consumption regimes, albeit something that's little recognized. And I'm sure Carol, with her work on midlife drinkers and midlife women's alcohol consumption, would echo some of these findings around, particularly in midlife or for those who are parents. There may already have been a significant shift to drinking at home, and we need to acknowledge that this is nothing new that's been caused just by lockdown. And the stats are there to support this too. By 2017, we know that less than a third of alcohol sold in the UK was purchased in restaurants and bars. So already 2/3 of alcohol purchased was for home consumption. Despite this, the shift from drinking in bars to drinking at home has received more limited attention. Maybe there's something about the very visible spectacle of binge drinking in public that invites the attention and the spotlight of the media and researchers, but there certainly seems to have been something of a gap around this kind of domestic consumption. And a review of the literature by Mayer et al. Suggests that studies of the impact of context on our drinking are actually quite limited, so not necessarily thinking about the context and the space in which we consume. But one thing that does seem to be coming through some of the literature on home drinking is that actually home drinking and hazardous drinking can be bound up together in particular ways. So Foster and Canfield argued that there were certain predictors of hazardous drinking, and these include increased frequency of home drinking, preloading or pre-drinking, drinking at home before going out, off-license purchasing of alcohol, and drinking alcohol at home to save money. And a large proportion of hazardous drinkers in their research drank at home 4 to 7 days of the week. So maybe the trope or the figure of the very drunk, public binge drinker out on the streets is, is slightly different to the reality of what might be happening in terms of home consumption. So it's important for public health initiatives to acknowledge the kinds of diverse drinking settings and to kind of consider the increasing trend in domestic consumption. So as Foster and Ferguson argue, those who mainly drink at home tend to consume higher amounts overall than those who do less drinking at home, which may have long-term public health consequences. And then the final kind of little couple of notes I wanted to make around context really was just thinking a little bit about some research from Briley Jones et al, thinking about what alcohol means in different contexts amongst almost 50 professional, managerial and clerical workers. And they talk about what they've called the home drinking habitus, which again I'm going to return to a little bit when we think about our findings too. And this idea that drinking wine at home could be positioned as a kind of source of cultural capital, a means of creating distinction through drinking wine in domestic space. And this was often contrasted with what was called the traditional drinking habitus, so the consumption of lager, beer and spirits to have fun in social settings. I also just wanted to briefly, and I'm not going to talk about it a huge amount today, but raise the idea that there is also scope for further research around the relationship between alcohol and internet-mediated communication and socializing. And this was something our participants did talk about, actually, the role of, opening a can of beer across a distance with a friend when you're, having a Zoom catch-up during lockdown. So, we know that there's a role that alcohol plays in terms of establishing connection and intimacy, and perhaps there's more to explore around how is this done online. So, thinking about the intersections between drinking and social media usage, and also importantly, thinking about synchronous drinking with others in virtually connected spaces. So there's limited research out there on the relationships between alcohol and online platforms such as Zoom and Skype. And as I said, not going to talk about it a huge amount today, but that was certainly starting to come through in our data as well. The ways in which, even purchasing the same alcohol as your friend so that you could be drinking the same things, keeping pace with each other on a Zoom catch-up, was a way to try and recreate a sense of intimacy and connection. And I don't know about you, but the amount of pub quizzes or the Zoom arms that I've been invited to, trying to set up a kind of social media platform as almost like a substitute for a pub or drinking space has been quite interesting as well. So moving on to think more specifically about the Drinking in Lockdown project then. So alongside Dom Conroy, Dom was really the lead on this project. We secured ethical approval, and then between us, we conducted a number of semi-structured interviews and household focus groups. So we were interested in speaking to current UK drinkers. We were fairly open in terms of there was no requirements around our participants drinking a certain amount per week or having a certain number of drinking occasions. We were interested in exploring a range of drinking behaviour, from lighter drinking or even non-drinking to much heavier drinking. So we were fairly open about that, as long as they were current UK drinkers. We invited participants to take part either in an interview or a household focus group. So 12 of our participants that we spoke to elected to take part in a one-to-one semi-structured interview. And we also conducted 4 household focus groups. And interestingly, all of our household focus groups ended up being more like a paired interview, if you like. So there were 2 people that took part in each of those. So that means we spoke to a total of 8 people across the 2 household focus groups. Now, in terms of timing, I should say as well, actually, although I think not all of our participants were English, but all of our participants were residing in England at the time of the research. So, I'm kind of thinking about and contextualizing these findings in relation to what was happening in England in terms of lockdown, etc. I know things are slightly different in Scotland, but just thinking about the English context in which the research was done, the initial lockdown in England started on the 23rd of March 2020, and our first interview took place 56 days after the start of the first lockdown, with our final interview taking place 150 days after. So what this means is that our first interview took place in mid-May and our final interview in mid-August. So if we conceptualize that on the increasingly messy timeline of lockdown, all of our data collection took place between the first and the second national lockdown in England. So some of them, the ones that took place around May, around June maybe, were just as things were starting to open up again. So we could ask participants, what do you envisage? Do you envisage going back to the pub, etc., etc. However, as we start moving into July and August, things are much more open. So in August, we see in England the ill-fated Eat Out to Help Out scheme, of course. So by the time we were speaking to these participants, things had been opened up much more in the UK. For it all to come crashing down again shortly afterwards, but there you go. So pubs reopened in England on the 4th of July, and 8 of our interviews took place before the pubs reopened, with 4 taking place afterwards. And in terms of the focus groups, they were evenly split. So half of our focus groups before the pubs reopened and half taking place afterwards. And really what we wanted to do in the interviews and the focus groups, they were sort of semi-structured, and we were interested in exploring drinking practices, routines and meanings. Part of this was really also about understanding relationships with alcohol and drinking practices before lockdown. So the role of alcohol in people's lives before the pandemic, and then thinking more about if and whether and how their relationships with alcohol and their drinking practices had changed during lockdown. And then finally looking forwards to their ideas about the future of their relationships with alcohol as lockdown was eased. And as I said, interested in exploring quite that range of drinking experiences and practices, and really getting participants to explore and explain in their own words what drinking meant to them, and how their relationships with alcohol might be changing. So we also invited participants who wanted to do so to complete an optional 1 week's drinks diary as well. So for those who were interested, we asked them in the week before their interview or household focus group to just keep a simple record of what they were drinking over this period, and send it to myself or Dom, whoever was conducting the interview, prior to the interview, so we could look through it and identify interesting things that might elicit further discussion. So 14 of our participants agreed to do a drinks diary, some in the individual interviews, some did it together with their partner or housemates in preparation for the household focus group. And really, you can see here, it's pretty basic what we asked them to do, just to indicate the date and the time when they had a drink, give us a sense of what they consumed during that period, and then provide a reason for drinking. You'll see here I've also included a reason for not drinking. So perhaps for those doing a household focus group, maybe if one of them had a beer after dinner, the other one might want to put a brief note in to indicate why they didn't have a drink on that particular occasion. Thinking about getting participants to think about the location and the company, and then any comments the participants had, any reflections around their drinking. And obviously this served as a form of data collection in itself to give us a sense of what people were drinking over a week, but really helpfully as something to elicit further discussion during the interview. So some of the comments were really quite interesting, and we could follow up on that in the interview and say, tell me a little bit about that, or tell me a bit about that drinking occasion. And participants certainly did say that, completing the diary did give them an opportunity to really reflect and think about their drinking practices over lockdown, to think about whether this was representative. And for some of them, it was quite interesting for them to think about, the reasons why they might have a drink on a particular occasion. So, I think that this definitely added something quite interesting in terms of thinking about encouraging participants to record their consumption over the course of 1 week. In terms of recruitment, we recruited primarily through social media, so Twitter, Facebook groups, and email. And we did secure a diverse range of participants in terms of age, which was quite interesting. And there was some interesting differentiation around findings in terms of age. So our youngest participant was 26 and our oldest was 65. And in terms of gender, again, a good balance in terms of speaking to those who identified as men and those who identified as women. In terms of where our sample was a little less diverse, certainly in terms of issues around race and ethnicity. So many of our participants were white, although not all of them were white British, and also predominantly a middle class sample as well. And I think this is important for me to flag up now as we get on to thinking about those discussions and findings. As I said, we didn't specifically set out to look at social class necessarily as a key focus of our study. So there is going to be immediately some limitation in terms of the findings or the conclusions that we can draw from the particular sample of drinkers that we spoke to. And there was a little bit of diversity and variation in our sample. So you'll see I've included, we didn't explicitly ask about social class, but I've included a bit of an indication there of some of the jobs that our participants did. Interestingly, we did have a number of academics and researchers who were quite interested in talking to us about their experiences as well. So obviously what I want to do for the remainder of the presentation, I've got these 3 themes that I want to unpack and talk about a little bit, but I just thought I'd actually take a little bit of time to just share the kind of overall headline findings that are coming through from our data. And again, if there's things that people wanted to build, follow up more on in the discussion, then this could act as a sort of springboard for that. So we're sort of in the early stages of our analysis. We're doing thematic analysis on all the interviews, which I should have said obviously all took place online and were recorded and transcribed verbatim. So in terms of what's coming through in our thematic analysis, the 2 main themes that we have identified are home drinking and drinking transitions. And each of those themes has 3 little sub-themes within that, if you like. So in terms of thinking about home drinking, the first sub-theme, which I find really interesting, is participants talking about the way in which the home acted as both an enabler of and a constraint on their drinking. So perhaps in some senses, the idea of the home being an enabler of drinking are easier to anticipate. So the idea that alcohol was very accessible within the home, for example, the idea that drinking at home was not bound by the opening and closing times of a bar, or even bound by having to get up and go to the bar and buy a drink, and of course certainly not bound by, you know, being deemed too drunk to get another round in, for example. So there was something to be said about the accessibility of alcohol, the idea for some participants that if it was there, if it was in the home space, in the fridge, they might drink it without really thinking about it. There was a bit of an idea of habit around that kind of consumption. So in some ways, some participants worried about that it would be easier to slip into drinking more without the constraints. You know, we tend to think of pubs and drinking spaces as enablers of consumption, you know, from the layout to happy hours, to, you know, to the music, the ways in which they're constructed to encourage consumption. But public drinking spaces may also place constraints on consumption that were absent at home. On the flip side of that, though, other participants talked about constraints on home drinking. Some talked about how in a Zoom-mediated situation, for example, they'd drink less because they'd be less likely to move away from the screen and go up to the fridge and get another drink. And participants also talked about how there's no escaping the evidence of your drinking when you consume alcohol at home. So whereas you wouldn't have to go to the pub the next day and be confronted with a row of empty pint glasses, participants did talk about the feeling when they put the recycling out and noted how many empty wine bottles there were, for example. So in some senses, there could be something confrontational about drinking at home, you know, being presented with the evidence of one's consumption, or through empty bottles, or knowing how much stock you had in the fridge and knowing how much you'd drunk, for example. The second sort of sub-theme around home drinking was around alcohol's ability to revitalize familiar home environments in two ways, really. So the first was around giving a sense of structure and normality to the home. And this, of course, might be particularly important in lockdown. So almost all of our participants were working at home or had been furloughed. And you know, that traditional distinction between work and home, that kind of work-life balance, was being eroded for many participants. There wasn't the sense of the daily commute or that separation between work and leisure. So alcohol could be important in terms of marking the boundaries of that transition to the evening or the weekend, for example, and giving a sense of normality, you know, that feeling of, well, just sharing a bottle of wine with my partner is something that we would usually do. But alcohol could also bring the social to the home as well. And this was perhaps particularly the case for those who were usually pub drinkers and had shifted some of their drinking, to the domestic space. So alcohol could be a way to create a kind of sociable environment when the pub was no longer available. And certainly two of my participants talked about creating a nightclub in their shed in the garden. They decked it out with fairy lights and speakers, and that's where they would go to do their kind of heavier consumption and play music and try and recreate a sort of clubbing environment. So, you know, finding creative ways to bring the social to the home through alcohol consumption. But then on the flip side of that, the third theme really around this area was around the home home is home, one of my participants said, and I don't want alcohol to be consumed in the home. So this idea that domestic space should somehow be kept separate or outside of alcohol consumption. And this could be for a few reasons. It could be because participants just really valued drinking in the pub, and their drinking was so bound up with socializing that they found it hard to transition or to move their drinking to the home. And particularly for those who lived alone, if they felt there was any kind of stigma around consuming alcohol on their own, they might be more likely to talk about not drinking more at home. And the final issue was around, you know, home as a safe space without alcohol. So this kind of linked to the point above, I guess, really, this idea that the home should be a space where alcohol wasn't consumed. There was something about alcohol that, you know, was linked to the public sphere rather than domestic space. And then in terms of our transition theme, really we've broadly grouped it into the kind of role of alcohol pre-lockdown, during lockdown, and possibly after lockdown. So in terms of the role of alcohol in life pre-lockdown, almost all of our participants reaffirmed the important role of alcohol in leisure, in socializing, in reaffirming friendships, particularly for some of the men that we spoke to, this idea starting to come through, which I'm sure we've seen elsewhere, around the role of alcohol in male friendships and how central drinking could be to that. And I've talked about this with the previous theme, I guess, really. But again, this idea that alcohol was marked periods of transition in the day, so the break from work, the evening or the weekend, and how that could be more significant in lockdown. Almost all of our participants also talked about the complete normalization of alcohol consumption and the expectation that you would drink. You know, to not drink is the choice that required explanation or justification. So all of them talked about feeling pressure or expectation, or just recognizing this normalization of consumption. In terms of drinking during lockdown, then I guess in a way our findings mirrored some of the other research out there, in that there was just not this clear-cut picture in terms of, was drinking increasing, was it decreasing, was it broadly staying the same? And one of the things that we actually saw was that there weren't these neat, clear-cut transitions. There was actually volatility in people's drinking practices, and fluctuation in drinking as well. So quite a common one, but by no means universal, was that people had seen a slight increase or even a bigger increase in their consumption early in lockdown, during the initial lockdown, and then that might trigger a period of reflection or a readjustment, a kind of recalibration to bring their drinking back closer into line with what the amount that they wanted to drink, or the amount that they used to drink before lockdown. So some of them, and some found, you know, there was quite a significant oscillation for some between dry periods and quite heavy drinking periods. So that volatility definitely coming through for some. For others, there were definitely increases in their consumption, and they talked about stress, boredom, having less responsibility and structure in lockdown as well. So this idea that, in particular, you know, not having the normal obligations and commitments of having to get up for work in the morning, having to commute, meant that they might drink more in the evening, meant that they might start drinking earlier. And also the kind of boredom of lockdown as well, particularly with being, you know, unable to use some of our other means of relaxation and leisure. Others talked about their drinking decreasing. So for some of the younger participants who might be very social drinkers and like to go out clubbing, they actually said that they were drinking less at home, because so much of their drinking was bound up with, you know, what they would admit was binge drinking on a Friday or Saturday night when they went clubbing. And then for still others, an idea of consistency and continuity. So particularly for some of the parents that we spoke to, they argued that their drinking had already shifted to the domestic sphere, and that the idea of, you know, putting the kids to bed and having a glass of wine with a partner, that was something that they did before lockdown anyway. So actually they'd already transitioned their consumption away from public space, so there hadn't been too much change. And then finally, thinking a little bit about emergent longer-term habits, and longer-term transitions or not, of course. So some participants were adamant that their drinking would just go back to how it was before, whenever normality was achieved again. So this idea that any changes or fluctuations in their drinking were really short-term. Others did anticipate that actually there might be some longer-term changes. They might have suggested they'd actually got quite used to drinking at home. They felt they might do more home drinking afterwards. Or they'd had a dry period, and they'd found that they really were reflecting on wanting to perhaps drink less or drink not at all going forward. So, and just to kind of, as another caveat here, obviously when I'm talking about these transitions, we're not thinking about them in a sort of absolute kind of sense. It's really about thinking about how transitions were quite fluid, not fixed. As I've said, it was as much about fluctuation and ups and downs as it was about these kind of fixed and stable transitions. Okay, so I just wanted to, for this kind of final part of the presentation, really think about, you know, when I got asked to do the seminar, and Dom and I really had to think, okay, well, how do we think some of those findings of ours could be linked into ideas around social inequalities? And you know, as I said, it wasn't something that we made the main focus of the research, but when we looked at our findings, we found a couple of interesting things coming through around, you know, thinking about themes around class, around socioeconomic status, and around social inequality. So the first theme I want to talk about is this idea of lockdown as an opportunity for growth and self-development. Then thinking about precarity, stress, and uncertainty as possible triggers for drinking. And finally, drawing on notions of class, taste, and luxury to explore how our participants might position their own drinking as, you know, respectable, in contrast to class ideas of problem drinking. So the first theme to think about really is this idea that lockdown actually provided opportunities for real reflection on one's drinking and perhaps for making changes to one's consumption. And here we found this idea of the teachable moment that Lawson and Flock talk about quite helpful. So a teachable moment gives us an opportunity to kind of try out or test out new behaviors and then maybe embed those new behaviors into the long term as well. And obviously one of the things we've seen significantly during lockdown is that it's broken those routines and those habits that people may have had around, for example, going to the pub after work or always having a night out on a Saturday night, for example. So what we saw with some of our participants who directly acknowledged this was that they felt it was possible to experiment a bit. They felt it was possible to have a bit of a dry period from alcohol or perhaps to drink less without having to do so against these kind of social pressures that come with going out. We know, and I certainly know from some of my research on sobriety, that declining a drink can come with real social consequences, from questioning to judgment to peer pressure. So in a way, lockdown removed some of that, and it allowed participants to press pause on their drinking, to reflect on their drinking, and even stop temporarily without facing particular consequences. But what I wanted to also think about in relation to this theme really was this idea of lockdown more widely as an opportunity for reflection and self-improvement and self-development and growth in terms of one's drinking. So what I should say as well, of course, using pseudonyms with these quotes, but here we have Lois saying, you know, in lockdown, I didn't want to increase my alcohol units. I was stuck at home 7 days a week. And if I was going to start drinking more, I'd feel rubbish. And I don't want to. I want to have a productive work day and exercise as well. I don't want to have this lockdown period as a time that would make me feel unhealthy or make me put weight on. So here, Lois draws on this narrative that lockdown should be this productive period for her. She doesn't want to come out of lockdown feeling unhealthy or feeling like she's gained weight. And here she draws on ideas of being, you know, a productive worker and being able to exercise as motivations for not making sure that she does not increase her consumption in any way. We see this really starkly illustrated as well with Alison. So Alison talked about, she'd actually recently moved not long before the pandemic started, but before then she talked about being in a real kind of habit or rut of going to the pub after work without really reflecting on why she wanted to. She was quite conscious that she wanted to kind of renegotiate that relationship with alcohol. And she talks about lockdown as this kind of significant moment when she really changed her relationship with alcohol and with diet and exercise as well. So she says, I've had this massive switch in lockdown and I was like, this is the time to do it. This is the time to change everything. So I've been doing Couch to 5K, which for those of us who don't know is a kind of running program, and a 90-day diet plan. So I've completely changed my diet. And she said, you know, everything is around exercise and healthy eating and healthy mindset. I just, you know, along with the exercise, it got to the point where I don't want to be the person at the end of lockdown who's drinking 2 bottles of wine a night because of lockdown. So in both Lois's and Alison's narratives, we see these accounts of wanting to kind of use lockdown as an opportunity for growth and self-development. And what we know is that these kinds of narratives around self-improvement and self-development tie into these wider neoliberal and possibly classed ideas of what the good self looks like. And we know from previous research by Yeomans, for example, so Henry Yeomans looks at Dry January and motivations for Dry January, and he argues that people can position the process of stopping drinking as a process of self-development and kind of ethical self-formation. So a way to construct yourself as a good sober, if only temporarily, good sober person. So this idea that, you know, sobriety, for example, could be linked to processes of growth and self-improvement. And certainly in my own work, where I look at women who stopped drinking, who were involved in online communities, around what I call positive sobriety, they very much drew on these kinds of narratives. And I talk in some of my other work around this idea of the enterprising self and these women positioning themselves as good citizens, as good mothers, as good partners, and the kind of opportunities for growth and self-improvement that came with sobriety. And we could certainly see this through our data as well. So to return to Alison, she says, you know, does your new normal have to be the worst version of yourself? You know, and here she's referencing on this idea of the new normal, that phrase widely used in lockdown. And she says, you know, use the new normal to be better. And then Indra as well, linking it into wider changes in her life. So she had a short period of abstinence, and she says, I made other adjustments during lockdown. I did yoga regularly, twice a week. And yes, I think lockdown's a nice opportunity to make some adjustments to your behaviours or habits. So, kind of really drawing on that idea of the teachable moment there. And if we return to that previous quote from Alison as well, again, we see here, she's not saying, she's not so much talking about the practices that she doesn't want to do. Here she's talking about the very person that she doesn't want to be, right? So she's not just saying, I don't want to drink a lot during lockdown. She says, I don't want to be the person at the end of lockdown who's drinking 2 bottles of wine a night. So these kind of linked into this idea of kind of identity formation and positioning oneself as a good person here. But of course, what I would argue here is that these kinds of ways of framing and thinking about lockdown may not be equally available to all. So Alison goes on to say, lockdown's the best thing ever. And I'm sure that that is a kind of subject position that is not equally available to all. So the argument here really is that, of course, those that have greater access to particular resources during lockdown, so maybe time, finances, space, or mobility, may be better able to embrace this kind of teachable moment narrative, right? So, there's this idea that you must already perhaps have a certain amount of resources to be able to kind of embrace or make the most of these opportunities to reflect on or reduce consumption. It's quite a privileged position perhaps to be able to frame and think about lockdown in these particular ways. And certainly within some of my work with women in sobriety, there is a suggestion of a kind of class narrative around these ideas of self-improvement and self-development that come with drinking. So the second theme that I wanted to talk about, which really, I guess, links quite nicely into that previous one, is if not everyone is able to kind of embrace the teachable moments of lockdown, then on the flip side of that, those who are most affected by stress, by precarity, by uncertainty of lockdown might perhaps be most vulnerable to potentially increasing their consumption. So those who might be most impacted by the pandemic may find it more difficult to reflect on their drinking habits. Now, as I've said, our sample was mainly middle class, and we don't want to make too many assumptions, but it might be fair to say that those who are particularly likely to be affected by financial worries during lockdown or by insecure living arrangements may be the least likely to embrace the kind of teachable moments philosophy. And certainly for our participants, they very much drew on links between the stress and uncertainty and anxiety of the pandemic and a risk of increased consumption. So here Kayla describes the initial lockdown scenario as abnormal, weird, unusual. And she goes on to say, it's not the way I'm used to working, and there was a lot of uncertainty as to whether my job was safe. The initial reaction was stress, uncertainty. What was the impact going to be for me, for my family and friends? Did I have to worry about finding a new job? And then she goes on to say the kind of consequences of that anxiety were, that extra glass of wine is not going to hurt, that extra glass of gin or a bottle of beer. And it wasn't that I was carefree or careless. It was just, oh God, what's going to happen tomorrow? Don't know, I'm going to have another one. So here, Kayla very clearly in her interview talked about this increase in her consumption at the start, the initial anxiety, the weirdness of lockdown, as well as the insecurity about her job and what was going to happen, facilitated an increase in her consumption. And Rachel had a similar experience, really. So Rachel talked about, perhaps of all the participants, she may have experienced the most kind of fluctuation in her drinking. So kind of guilty periods of abstinence followed by quite heavy periods of consumption. And she says, you kind of have this fatalistic, what's the point of it all attitude? What's the point of trying to be healthy when the whole world's gone to shit? And she talks about the correlation between alcohol and kind of forgetting things and relaxing, and says, she thinks people's moods during lockdown have been a bit of a roller coaster. And then she says, I don't even know if I'm going to have a job in September. And then the secondary impacts of the lockdown, the stuff that's going on at work, the redundancies, people's jobs at risk, the secondary impact of COVID on people's mental states. So she draws links here between her own consumption and the kind of stress and anxiety of lockdown, but also suggests that she thinks that more widely, she wonders if people might be using alcohol in this particular way. And we know from other research as well that's kind of emerging around the pandemic. So Callanan et al. Suggests that drinkers experiencing high levels of stress are the most likely to report increases in their consumption. And if we think back to that alcohol change survey that we touched on, the survey reports that 1 in 5 of those surveyed said that they drank alcohol to handle stress or anxiety during lockdown. And of those who drank more heavily during lockdown, 40% said it was a response to stress or anxiety. So although maybe the links are a little tenuous in our data, it gets us thinking about, okay, who is most adversely impacted by the pandemic and the stress and uncertainty that it brings, and how then might that link into people's consumption patterns? And the second example that I wanted to give around this theme was around thinking a little bit about a possible kind of compounding of social and health inequalities, and the ways in which those who are already experiencing significant health issues, for example, may be more adversely affected by the pandemic and more likely to see increased consumption. So I'm going to turn to one of the household focus groups now with participants Joan and Nigel, who were both in their mid-60s. And I want to think about the ways in which Joan and Nigel's existing kind of health situations, if you like, fed into and contributed to their consumption. So early on in the focus group, Joan and Nigel talked about their, numerous existing health conditions. So diabetes, obesity, being immunosuppressed and having limited mobility and finding it really difficult to get out and about during lockdown. And they went on to talk about they'd recently moved house to a new part of the country, the excitement that they'd felt about getting out in their car and exploring, going to National Trust properties, but then how lockdown really kind of suffocated the opportunities that they felt that they had to get out and about. And they often linked that to the fact that sometimes when they tried to go for walks, because coffee shops weren't open, they couldn't sit and have a coffee and have a rest and then walk a bit further. So literally their ability to kind of occupy and move through space felt more limited during the pandemic. And at one point in the interview, I returned to something that Joan had said earlier, and I said, you said quite early on in the interview, Joan, it's a bit of an escape in lockdown as well to be drinking. And Joan says, yes, definitely. Obviously, lockdown has affected everyone. I'm not trying to say we're special because we've got poor mobility. And she goes on to say, which I think is very interesting, in a way, you tend to feel it's a bit like a compensation as well at times. Drinking, she means, rather than sitting there feeling I can't do this and I can't do that. So in this way, she's positioning alcohol as something that compensates for the fact that her world has shrunk a little and there seem to be less opportunities to do things with her partner. And Nigel kind of jumps in there as well and re-emphasizes the point. He says, we can't walk that far in one go. And then back to Joan, she says, it helps relieve the boredom. What can you say? The drag of every day being the same. Before you might be going somewhere or you might not, but at least you have the choice. Whereas now it's easier to think, sod it, I might as well have a couple of glasses of wine and chill out. So for both Joan and Nigel, their consumption, they were very heavy drinkers before lockdown, both daily drinkers, but their consumption had shifted much earlier in the day because of the boredom and the feeling that things were so restricted and difficult for them during lockdown. Also, of course, if we're going to think about social and health inequalities here, the fact that Joan and Nigel might have felt particularly vulnerable to COVID as well. So this idea that as a couple in their 60s with underlying health conditions, those wider anxieties about their health and about the risk of COVID directly to them may also have played into some of their consumption patterns. So the final theme that I wanted to draw on really was thinking about the ways in which some of our participants drew on these ideas around class, around taste, and around luxury in order to position their own drinking as acceptable in contrast to kind of ideas of problem drinking. And this, of course, may be a classed process. So our participants used these kind of discursive strategies to position their own consumption as normal, tasteful, sophisticated, and moderate. Now, what's interesting, of course, about lockdown is that we may have been required for some of us to, cross the lines that we drew in the sand around our drinking. So drinking at home, drinking on your own, or drinking more might be seen as problematic. And participants who engaged in these practices, had to work actively to construct these kinds of practices as acceptable during lockdown. So for our middle class participants, they sometimes drew on these kind of class stereotypes and understandings of problem drinking that were weaved into the ways in which they positioned their own consumption. So here, our participant Stephen talks about, or justifies, if you like, the consumption of the bottle of wine on a Saturday night during lockdown. And he says it's special, it's a treat. That bottle of wine on a Saturday night is an expensive bottle of wine. And he re-emphasizes this again later. It's a really expensive bottle of wine, so it lasts the night. It's taken with pleasure. For me, it's about the luxury of alcohol, the highest quality that you can afford. So what he's doing here, and I mean, this is interesting because, to be fair, Stephen might have engaged in these kinds of practices prior to lockdown, but they may become particularly important when people are seeing, increases in drinking or a shift to home consumption. And this links into Briley Jones et al.'s work, this idea that class and respectability can be constructed through wine drinking in domestic space, the kind of home drinking habitus. This idea that this kind of drinking is respectable and sophisticated, and that the home drinking habitus gives us a kind of cultural capital and a means of distinction. And what's interesting here is the way in which Stephen contrasts his own consumption with the kind of pathologized problem drinking. And of course, we see more widely this ability sometimes for that middle class drinking to kind of go under the radar and not be subject to such scrutiny. So the kind of hidden problem, if you like, of the middle class domestic drinking that's not framed in the same ways as highly visible or supposedly more problematic drinking displays. So Stephen, in the middle of this quote here, he contrasts his own drinking with what he calls the bottle of plonk, neck it, get it down and whatever, and then get another one down me and all the rest of it because it's like £3 a bottle or something crazy. He's actively distancing himself from these more problematic kinds of consumption patterns as he sees it. So in these are kind of classed ways of excusing and justifying one's consumption and pathologizing other particular drinking practices and choices. So I just wanted to end flagging up a couple of limitations of the study, really. So, and to be fair, I've probably kind of touched on these as we go, but obviously our sample was small, we can't generalize, and predominantly middle class and self-selecting, of course. So the people that came to talk to us were the ones who felt comfortable and able to talk about their consumption, or they wanted to share with us, the amazing opportunities they'd had in lockdown to cut down or drink less. So we're not reaching hidden populations with our research. And although we have got some diversity in terms of age, we've not considered issues around race and ethnicity either. So going back to that alcohol change survey, some of the findings were around how those from Black, Asian and minority ethnic backgrounds were actually more likely to argue that they drunk as a way to handle stress or anxiety during the pandemic than white people. So this idea that actually, again, how do the nuances of things like race and ethnicity intersect with drinking during the pandemic? And again, I've talked about these limitations with other research, but certainly with ours, the kind of self-reporting nature and the snapshot in time. When we set out to do the data collection, we actually worried that lockdown would be over before we could collect any data. And of course, we're still living through the lockdown over a year later. So, our own little snapshot between lockdown 1 and lockdown 2 in England may already be somewhat out of date. And I've talked about transitions not being clear cut, about fluctuations, and also it's difficult to assess the potential for longer term change. We overuse the phrase unprecedented times, but it really is. Will we see something of a kind of reconfiguration or return to previous drinking practices after lockdown? Okay, so whilst our own sample was mainly middle class, and we know that we didn't speak to those who were in particularly precarious situations during lockdown, our findings open up opportunities for, getting started with some further discussion around some of these kinds of questions. So this idea, I think, of lockdown as a kind of teachable moment and an opportunity for reflection and growth, both in terms of drinking, but also, I think, more widely. I think this is really interesting. But is this inherently classed? Are some people more readily able to adopt these kinds of positionings than others? Secondly, if we're starting to see links between increased drinking and between emotions such as stress, anxiety, and uncertainty during the pandemic, is this likely to disproportionately affect those who are already experiencing life in more precarious positions? And then finally, can thinking about issues of class and taste help us to understand the ways in which drinkers rationalise their consumption during the pandemic? I also, for those of you that know me, will know that I'm a gender scholar, just couldn't get away without just flagging up another question that we might want to think about a bit in the discussion, which is, of course, I focused a little bit around class and social inequality today, but Can we think about the ways in which gender, for example, is experienced during the pandemic, and how is that entangled with one's alcohol consumption? So certainly for our participants, this notion that drinking was a way to kind of mark the transition to the evening when the kids had gone to bed, kind of a reward for parenting, which I think is echoed more widely in this emerging sort of mummy wine culture that we see, which links parenting, particularly motherhood, with alcohol consumption. So, you know, where we were starting to see, particularly the women in our sample, talking about using alcohol in this way. We also know that women are disproportionately affected by, for example, being furloughed, and are more likely to have caring responsibilities, both for children, but also perhaps worrying about parents or an older generation as well. So again, perhaps thinking going forward in future research, how are some of these issues playing into people's consumption habits? Got a ton of references, which I won't go through, but just to say a huge thank you to everyone, and I really look forward to opening up the floor for discussion.